Hi, everyone. Welcome to Mama Wears Athleisure. I am your host, Mariela de Santiago, a first-time mom. We focus on all things mom with tips to help make life easier and more organized for all you mamas out there. Hi, everyone. Today I am here with Marisa. We are going to talk a little bit about what you can do up to 8 weeks postpartum that can help you build that strength in your core and ease back into fitness.
Thank you so much for having me. I'm so excited to talk with you and educate more women on the early postpartum phase, which is so important, such a critical time for healing. A little bit about me is I am a pelvic floor physical therapist. I see women of all ages with all conditions, but I do specialize in postpartum work and postpartum rehab. My business is online, so I provide virtual physical therapy if it's appropriate, or coaching services. It just depends on the person's needs. And I really am helping women with their postpartum recovery, pelvic health conditions, providing education and preventative care so that they can have a more confident, empowered, informed recovery and really understand their pelvic health and wellness. So we can get into my program a little bit, but what we're going to talk about today is what I do for women in the early postpartum period, which is that time where it's often forgotten in recovery. And there's a little bit of that space in between like 0 and 6 weeks where you give birth and then you see your doctor at 6 weeks postpartum, and we're kind of left unsupported in that time. So that's the area that I really love to support women in.
Yeah. And generally, when you go see your doctor at that 6 week, regardless of your form of delivery, that's typically when you get your clearance to actually work out. When I say work out, I mean being able to run, lift weights, do all of these things that would be a little bit more extenuating, I guess. But your program is different in that it's helping you ease into that. So for this purpose, would something like this require a doctor approval?
That's a great question. There's definitely like that 6 week clearance is just very vague, right? We're told that we could return to exercise, but there's really no guidance on what we should do first, what is safe. Like, can I go do a HIIT workout right now? Can I go do jump squats and run right now at 6 weeks postpartum when I've done nothing in the last 6 weeks? So it's just a little vague. It's unclear. What the guidelines are now, although we're all just a little bit behind in following it, is that it is safe to begin like really gentle movement and abdominal activation exercises within the first few days of delivering. Specifically, it's safe within the first few days of a vaginal birth. And it is recommended that if you have a cesarean or like a complicated pregnancy or complications during your birth, that you receive clearance from your doctor. But generally, it is safe if the exercises are appropriate and if you're doing them correctly.
You make such a valid point about, once you get the 6 week mark, you're kind of like, okay, great, you can work out. And yeah, you have absolutely no idea what that means, because from my perspective, I ran up until the day that I delivered my son. I say we because it was him and I. We would do HIIT, we'd do yoga, we did everything. And then all of a sudden I had a C-section. So I couldn't do anything and didn't realize that my muscles were torn into and I had to build that strength up. So a lot of what I learned was, me doing my own research or Peloton teaching me a lot of that, because I did a lot of the postpartum exercise where they would actually walk you through, here's what you need to build up. So
I've heard those are really great on Peloton. Good for Peloton.
Yes, because you really don't realize, like, why is there a postpartum workout? Like, what? I'm good to work out. Well, because we as women don't have that core strength after having literally had your stomach muscles stretched, and now you have to get them to come back down to what they were prior. What can mamas do during these initial first 8 weeks, which is where your program comes in to help strengthen that core, whatever it is that you do to help them before they are able to get back into a HIIT workout?
I like to describe those first 8 weeks as reestablishing that connection between your mind and your body, familiarizing your nervous system with your abdominal muscles again and your pelvic floor. Because you're right, there are so many changes that happen through pregnancy. The abdominal muscles are lengthened, which causes them to become a little bit thinner. Our posture changes, our pelvic floor becomes becomes a little bit weaker and possibly tighter. So with all these changes, we use the muscles differently when we're pregnant. We move differently. We have different movement patterns and strategies. What we really need to do in the early postpartum period to set ourselves up for success with returning to exercise is retraining our breathing patterns, connecting to our diaphragm. You know, our ribs are flared with pregnancy, and anyone who's been pregnant knows how it feels to like not be able to take a deep breath because your diaphragm feels like it's just kind of shoved up into your ribs. So we need to reestablish that diaphragm movement, breathing patterns, learn how to reactivate your deep core muscles, learn to find your deep core muscles. So many people, when I work with them in the early postpartum time, the first week, they'll say like they don't really know if they're doing it right. They can't really feel the activation. And then a couple of weeks into it, they realize they can totally start feeling that mind muscle connection. So you really have to retrain it with your nervous system. And then also just like beginning to gently progress abdominal activation exercises strategically. So you don't want to do too much too soon. It's finding that balance between doing nothing and doing too much before your body is prepared for it. So really progressively overloading your abdominal muscles. As a physical therapist, I'm always thinking about like function, of course. So what will a person need as a mom? We'll need glute strength, core strength. We need upper back strength, kind of just connecting to the abdominal muscles, the pelvic floor, and learning how to use them with your daily movements, and then setting you up for success with exercise.
And you just mentioned the two areas that tend to really be affected during pregnancy, pelvic floor and the abdominal or core muscles.
And with my program, I do focus on like full body recovery. I've used my experience with what I've seen in postpartum women coming to pelvic floor therapy and like the issues that they've experienced and what they've struggled with physically and mentally. So that's what I kept in mind creating my program. Like, okay, preventatively, what do women need? So I always say, I don't want you to end up on my treatment table. I don't want to see you for physical therapy. I want you to have the tools so you can manage it and prevent it on your own.
So important, that preventative piece, because we tend to always want to fix something rather than try to avoid something happening.
Yes, absolutely.
So I would love for you to share a little bit about how your program does all of this and really targets that early postpartum and how you are able to support mamas. Again, this is all virtual, right? Your program is all virtual.
Yes. Yeah.
So anybody can reach out to you and do this.
Anybody can do this. Yeah. It's an 8-week program, and each week consists of 3 strength workouts, and they're typically like 15 to 25 minutes. I wanted to keep them really manageable. Each week, there are 2 5-minute mobility workouts, which seem to be the fan favorite. Everybody loves the 5-minute mobility. It's totally doable. It feels really good. I wanted that to just be restorative for recovery and just connecting to your body and your breath. So that is mostly like mobility that will help you with injury prevention and overall recovery. The 3 strength workouts, I do call them workouts. However, the first few weeks are super gentle. So I always let people know that it's a little bit slow. That's the time for connection building type exercises, reconnecting to your muscles, reestablishing that foundation that you need. Around week 3 or 4, it starts to pick up and get a little bit more fun. And at that point, energy levels are a little bit better. You're feeling a little bit more in your body, feeling a little bit more like yourself. That's when it becomes a little bit more fun. It's minimal equipment, at home, self-paced. So I do provide the program through an app. So currently, if you sign up for the program, you have access to me through the messenger on the app throughout the whole program, which is really cool. And I'm loving that feature. I'm loving like keeping up with participants and getting their feedback and getting their questions and being able to give them education that they need throughout. But, it is a weekly program that you can do on your own time. And I just always recommend to stay consistent with the progression because it is really strategic. Like I describe it, it was like a work of art creating this progression. I spent weeks and weeks looking at every day, making sure it flowed perfectly and slowly, progressively overloading with increasing range of motion and sets and reps and the depth of movement. So it's just really intentional, which is what's necessary for it to be therapeutic during that time. The early postpartum time isn't the time to really challenge yourself, even though you might have, like I've heard women say, like, I just have this energy to run. Like, I'm not even a runner and I just want to go run. You have this like superpower type energy sometimes after you give birth, but it's not the time for that. It's the time for just reconnecting to yourself on a mental, physical, emotional level. The other thing that I really love about the program is I do provide education like a few times a week. So you'll get a little like educational tip. It'll either be like postpartum education or what to expect postpartum, or, is this normal? Is this not normal? So I really want to educate people on the distinction between common and normal, because often women are left suffering in silence because they never receive that education of like, sure, incontinence and leaking when you jump and sneeze is common, but it's not normal. You shouldn't have to live with that. So I provide education like that so that people can get help sooner if they end up having pelvic floor dysfunction, and how to ideally prevent pelvic floor and core dysfunction.
I know ideally it would be nice for somebody to jump in right after they had their baby. But if somebody doesn't learn about this until, let's say, 3 weeks, 4 weeks, is it still okay for them to come in and partake in this program? Or what are your recommendations on all of that?
So I do recommend starting it anywhere from first 4 weeks postpartum. If someone is 5 or 6 or 7 weeks postpartum and they haven't started any form of like core activation or exercise yet, it is definitely still appropriate, because again, it's still going to set you up with that foundation that you need. So it might feel a little bit slower at that point, but it is still going to be really important and beneficial. And although the recommendations now are like, hey, start within a few days, that's not realistic for everyone. Not everyone's feeling up to it. So I tell women you can start week 1 or when you're ready. So I've had people start at week 1, week 2, week 3 postpartum. I have someone who just joined at week 4 postpartum, and she's just feeling really disconnected to her core. So it's going to be very appropriate for her. So you have to be not only feeling physically ready with your healing, but also mentally in the right headspace for it. That's something that's so important. I don't want it to be discouraging if you can't get to your workouts, if you're not feeling up to it. I want it to be something that's empowering and something that is for you to meet your body where it is. So I do want women to just start whenever they feel ready, and then you'll get the maximum benefits of it. You'll be able to show up for yourself. The improvements in mental health and physical health will just be much easier if you're feeling up to it.
Yeah, very good points. You do need to feel like you are ready for that. I know after I had my son, for me, it was like I just needed to walk slow.
Mm-hmm.
So even though it was very slow paced and probably the pace of a snail, it was still something that I kind of just needed to be able to like know that I was doing something for myself and to just help with that healing process.
Yeah. I'm glad you bring that up, because I have had almost every participant tell me when they're giving me feedback on that first week or two, they said, just like that, they said, it feels so good to do something for myself a few times a week, just to be alone for 10 minutes. And especially those first couple of weeks of the program, because they are so therapeutic and gentle, that it feels relaxing. Like I had a lot of women tell me they were doing it before bed because it just felt really good. Yeah, I totally agree. I think that the mental health aspect of it is also really important, but you do need to feel ready for it.
One other thing, since you did mention, like for certain forms of whether pregnancy or delivery, they would need doctor approval. Do you initially, when you meet with them, determine and decide whether it is necessary for them to have a doctor approval before starting your program?
I provide a welcome email with all of the information that you need about the program when you first sign up. And in the first couple of weeks, when you are a little bit more vulnerable, I provide modifications for a cesarean. But in that welcome email, it describes, after you can start as early as week 1 after a vaginal birth, or, get clearance from a doctor after cesarean birth, or wait a couple of weeks. However, most people do communicate with me before they start. So I'm having those conversations over email, or they're DMing me on Instagram and we're talking it out. They'll often ask me, hey, do you think I'm ready? And we'll talk about, how are you feeling? What was your birth like? What was your pregnancy like? And then based on that, I can give them specific recommendations. For the most part, at this point, anyone who did have a cesarean just waited an extra couple of weeks until they felt ready. So someone with a vaginal birth may be feeling more up to it at week 1, and that's totally expected. But with a cesarean birth, although it would be mostly safe, and I did create it for it to be safe either way, it's typically recommended to wait just a couple more weeks. And if you do that, then you should be good to go.
Finally, we're getting to my last question with getting any tips, recommendations, or suggestions that you have. But with that, I know that you already have a wait list, so it's clearly a very popular program. So if you could also just kind of share a little bit about how long are people expecting to be on the wait list Are you considering or trying to add more availability or spots?
Because of that message access to me, I'm trying to keep it to smaller groups because it would just be hard for me to keep up with everyone if they were all messaging me. And I do want to give anyone that's going through the program my full attention. So how I'm currently navigating it is I'm opening registration every other month. And it's usually like earlier in the month, every other month. So I did just do a March enrollment and just getting on that wait list ahead of time so that you are notified by email as soon as it opens for the upcoming month. If you're on the wait list, you can get in for that upcoming month. It's just about like being strategic for when you sign up so that you don't end up like delivering and then having to wait 5 weeks. The other thing is that you can sign up even if you're still pregnant, just to lock yourself in. And then I'll know when you're delivering. Once you actually have the baby and you're ready to start, you'll let me know and we'll set you up. So as long as you're on that wait list, whether you're pregnant or already postpartum, as soon as registration opens, you'll get an email and you can sign up whenever you're ready.
Thank you so much. Any other tips, recommendations, or anything else that you'd like to share?
Yeah, I just want to tell everyone to feel confident advocating for themselves and seeking care, whether it's preventatively or if they're already experiencing pelvic floor symptoms. I find that the first 6 weeks is different for everyone. Some women are having more pelvic floor dysfunction type symptoms that are expected and normal early on, but then if they persist beyond that, they're not. So I want people to understand that they can speak up, they can reach out to their medical providers, they can request an earlier appointment if they feel like they need it, and they can seek physical therapy care or a preventative program like this. And unfortunately, we shouldn't wait for a referral because that doesn't always come, and we still have a long way to go with that. So I want people to know that this is their healing experience and this is their recovery, and they can do whatever they feel that they need without someone referring them. So just advocate for yourselves and seek care. And my email and my messages are always open. I love talking with people on there, so they could reach out to me if they have any questions about their own experience as well.
So important. And I know that a lot of the people that I interview always say advocate, which is kind of a bummer that we, have to do that. But also at the same time, very, very important, especially if you feel something or feel that you need something, because a lot of the times, you won't get that attention unless you definitely make your voice heard.
Absolutely.
Well, thank you so much. I appreciate you taking time. And it was so nice to learn more about your program. And
thank you so much for having me.
I'll have all of your information linked. So if anyone is interested in signing up for that wait list, they can get to that from the show notes.
Yeah, perfect. Thank you so much.
Thank you for listening. Tune in next week for our next episode. You can find us on Instagram for more updates and tips. Be sure to subscribe wherever you listen to your podcasts and give us a review if you like us.